is Norm Volsky, your host, and this is the Digital Health Heavyweights podcast.
Thanks, Norm. It's an honor to be here, and it's been fun to work with you over the years.
Hello, and welcome to the Digital Health Heavyweights podcast with your host, Norm Volsky. And today we are thrilled to be joined by the CEO and founder of Align Marketplace, Patrick Nelli. Patrick, welcome to the podcast.
Thanks, Norm. Thanks for having me. Really appreciate it.
My pleasure. I'm really excited to be joined by you. And for all of our viewers and listeners that aren't as familiar with Patrick as we are, Align is the only national and value-based advanced primary care network. Through a single, easy-to-administer contract, you get access to a national network comprised of over 3,000 locations and coverage in all 50 states. Previously, Patrick was CFO and president of Health Catalyst, which had a really nice exit. Prior to that, Patrick had a robust career in private equity and finance at GTCR, Golder, Rauner, and McCall Partners. Patrick attended Wake Forest University and is very passionate about improving America's health span through better health outcomes, lower cost for employees, and employers nationwide. Really excited to have you on the podcast and to tell us all about what Aligned is doing and how you're making a great impact, for patients and employers. So really excited to have you on.
Thanks again, Norm.
Absolutely. So what inspired you to get into, healthcare finance? Because that's where your healthcare journey began.
Yeah, for sure. So the framework I've always liked is that I heard early on is that you want to try to find careers or opportunities that are at the intersection of what the world needs, what you can be good at, and what you enjoy doing. And so for me, early on, I was always drawn to the healthcare space. So it actually started before healthcare finance. I was physics major, but biophysics, biochem concentration in the laboratory doing a bunch of drug discovery research. Mm-hmm. And it was a fun experience, but what I learned is it takes a little while to turn an innovation in the laboratory into a positive patient impact. So I wanted to try to learn more about the business side of healthcare. So that's what ultimately led me to investment banking and private equity, kind of healthcare finance, to your point. So for me, really, like the fixed part of that equation has always been to try to maximize the positive health impact I can have on individuals. The variable parts have been figuring out what I'm good at and what I enjoy doing. Mm-hmm. So anyway, that's what led me to it. And I will say, the investment banking route, the private equity route, were kind of an unbelievable MBA type experience.
What does that make you a better executive and even CEO and founder coming from that world?
Yeah, exactly. I think it's a great chance to learn, healthcare is pretty complicated. So figuring out the payment flows, figuring out the different business models, figuring out incentives and what makes them tick, getting a crash course in that for several years was helpful because, to your point, ultimately I decided that it was very intellectually stimulating to be on the investing side, but I wanted to work at a startup, work at an operating company that kind of built.
And was Health Catalyst your first opportunity to do that?
Yeah, it was. So
walk us through how you found Health Catalyst, how they found you, why you felt that was the risk worth taking, because usually leaving private equity, venture capital is not always going to be popular among your, collegiate friends. It's kind of like seen as the pinnacle of success. It's like, why do you walk away from that to, go into the vendor world where, success is not guaranteed?
Good point. The best risk-adjusted returns, if you're going to be broadly in healthcare, is to be on the investing side. It's not to be on the startup side. For me, it was, once again, that mission, like what the world needs was fixed, like trying to drive healthcare improvement. What I thought is I felt like I had more of a passion. At least at that point in time, I just wanted to try out what it was like to be able to start up and build products. So yeah, what that process was, I was inspired. Peter Thiel has a good framework, which is to join a rocket ship. Like when you're looking for startups, just find one that will grow fast or is growing fast. Because when it grows fast, it means the company needs a lot more things to be done. And if you prove yourself, you can take on more responsibility. So I always liked that advice. The couple tweaks I made at the time was to find a rocket ship that has a mission that you relate to, because then you're going to be more passionate about it and perform better, and that has a culture that you relate to. Because ultimately what you want is you want to be able to prove yourself and then be given more responsibility. Well, that only works if companies are willing to follow that path, to kind of promote from within, if you will. Anyway, all of that led me through kind of doing diligence with actually VC investors. It led me to Health Catalyst. And that experience actually was pretty funny, where I was interviewing, and I was interviewing with a number of people, but including Dan Burton. He was CEO then, he's still CEO. And Dan is the best human being I've ever worked with. Like, just
Wow. High praise.
a great individual. But this first experience is pretty funny, where I was interviewing with him and I said, I'd love to be your chief of staff. And he shared that that would probably be great for me, but he would love for the company to get some value early on out of the relationship. So he was like, why don't you come in and do something we know you can do, like finance,
Yeah.
and then prove
Did you
yourself.
come in as VP of Corporate Analytics?
So I actually had a short stint doing finance, FP&A.
Okay.
But he said, look, prove yourself and figure out what the company needs. And if you have a skill set there, like, we will let you kind of follow your passion as long as the company needs it. And we think you have a skill set there. So I actually went and spoke for the first 2 months I was there, had lunch with a different person every day across the business. It wasn't that big of a business.
How long was it? Weeks, months?
For a couple months, for 2 months.
And
And
were you able to keep the weight off?
yeah, exactly.
Eating out every day for 2 months, you could really pack on some pounds if you're not careful.
I was a little younger then, so it was a little easier. But anyway, so it was a great chance to like meet a lot of people in the company, figure out what was needed. Our co-founders, so Tom Burton and Steve Barlow, who are the most mission-oriented individuals you'll ever meet, they decided that we needed a business operations function, kind of a corporate analytics function is what we call it at Health Catalyst. And so they let me start that. So it was this kind of a little bit of leap of faith on my side that I could trust them, and a leap of faith on their side that they could give me more responsibility. Anyway, that's what ultimately led to that first corporate analytics role at Health Catalyst.
And what made Dan and some of the other executives at Health Catalyst just so special? And like, what did you look for in leaders that obviously was the right way to think about it? Because the company did well, you did well. It was just a match made in heaven. And like, what advice would you give people looking to maybe transition their career, and what to look for to identify a great leader?
Yeah. So from a company perspective, we talked about the rocket ship. From a culture perspective, I think a lot of great cultures are built based on individuals. Just like, it turns out, if you're a good human being, there's a lot of good core principles that translate into company building. So I would look for companies that clearly have principles that they try to operate under, that should be timeless, like kind of unchanging principles: respect, transparency, ownership, humility, principles such as that. So that is certainly something to look for. Promoting from within, especially being more junior, is like something you want to hear, that they strive for that when an individual has proven themselves.
Yeah, tie goes to the person who's been here.
Exactly. So that's what I saw in them, which, by the way, was extremely true from being in the trenches with them for nearly a decade. And that's what I would look for as well. Because to your point, from the outside looking in, it's hard to judge a culture perfectly, but you can still get hints at it by through interviews.
There's some leading indicators, without doubt. So walk us through how you rose from FP&A to president. I know it was a long run. I know there's plenty of time to, build your personal brand and accomplish a hell of a lot in that decade. But walk us through that transition, and like, what advice would you give people that want the big title, that want a lot of responsibility? Like, what are the things you need to do to give yourself the chance to be promoted and to be tapped on the shoulder for bigger and bigger roles time and time again?
Yeah. So for me, we talked about corporate analytics. From there, moved to the product side, helped build one of our product lines, then moved into the CFO role, which was a fun experience, helped take the company public. I then was president, to your point, where growth reported to me. So it was fun to kind of get to touch a little bit of all the business over time. I think similar to prioritizing a career, there's kind of a similar framework to thinking about your career within a company.
Hmm.
But instead of it, what the world needs, it's kind of what the company needs. So like, what does the company need over the next 18 to 24 months that you see? What are you good at, and what are you passionate about? And I think it's important to be a little flexible there, if that makes sense, because company needs change over time. Like, what is most important for the company changes a lot, as companies progress. So I think there's definitely like a give and take, I think, between companies and individuals. And you always want it to be a win-win, but you want to have some flexibility. Think about it more from like that framework than an exact role that you're shooting for. And you have to obviously prove yourself in whatever your core responsibility is to then
Yeah.
give it more.
What was your personal directive? And like, what were the things that you were telling yourself in those early years that set you up to succeed later?
Yeah, I think my personal directive was probably more about just trying to have as big of an impact as I could. Like it really was just like, it turns out hard work really solves a lot. Like if you just work harder than other individuals, that usually goes pretty far. So that was trained into me from the investment banking and private equity
Yep.
world.
No,
Um,
those worlds are known for work ethic and high standards.
yeah, so that was a big part is like hard work. But also for me, I knew once I was there for a few months, I knew I wanted to start a company in the healthcare space.
Yep.
It was like, I love this. Like, it's so fun to build something new and try to like bring something new and change the world. So that was like the end goal in sight. And for me, it was like, let me try to learn as much, help as much as I can to get experiences to ultimately be able to, start a company one day.
Yeah. And I think the things you did that almost probably were innate for you and like you didn't really have to give it a lot of thought, but is really good advice for others is a couple of things. First, I would argue the most important thing that you can build a reputation for in your company is reliability. Like, are they able to rely on you? And if a task is given to you, do they have the highest confidence that you're going to be able to deliver? And you're going to deliver a quality product or experience or interaction with outside stakeholders. That's first and foremost. Second, you're gonna do what it takes, right? Like that's where work ethic comes in. Like work ethic is, hey, I spent the extra hour after 5 o'clock because I knew this needed to be done for the client tomorrow. And I wasn't willing to lower my quality threshold just because it wasn't convenient for me. I was willing to make sacrifices, I was willing to put in that extra work. So again, like work ethic is important, but it has to be guided towards the right things and focused on the right outcomes. So I think it's really important in careers to have like a very, very strong North Star where when push comes to shove and it's not an easy decision, what is your North Star? What is the thing you're trying to accomplish more than anything else? Again, for you, maybe you weren't like thinking consciously about it, but like your subconscious was, hey, I want to be Dan's go-to person. Like if push came to shove and there was something that like the company's growth depended on it, who did he trust most to like hand the keys to? And you became that guy over time by continuing, to really outperform every time they gave you a new task or new responsibility or new team or new job, whatever. So that's like a really good North Star is like, how can I become the CEO and the board and the investors' go to person when there's a key objective and they don't know who it would naturally go to? Like, that's what gives people the opportunity to do things and get tapped on the shoulder for jobs that don't even get posted. I think that's a really important concept. And for me in my career, my North Star this whole time is how can I be the CEO's go to person when they have an issue with their company and they're looking to solve it.
Yeah.
And if I'm that person, I'm going to get a lot of opportunities, but you have to earn that every single day and every interaction and every thing they ask you to do. You got to be reliable. You got to do it at a high level. You got to have really high quality. Like all of that factors in. So you try to really simplify things because otherwise you can get so much advice from so many different places you don't know where to start.
Yeah, I love that. There's a good book, The Speed of Trust by Stephen H. Covey, the Stephen Covey's son. And it talks about keeping commitments is actually a foundational element to engendering trust. So, like at Align Marketplace, one of our operating principles is we keep our commitments.
Yeah.
We do what we said we're going to do. Because of that, because to your point, that is the fastest way to earn trust. It's just like do what you said you were going to do.
And if you don't, it's the fastest way to lose trust.
Totally. Yeah, yeah. So it makes sense.
Yep. Love it. What were the successes you were most proud of in your time at Health Catalyst?
I mean, for me personally, getting to touch all parts of the business was pretty fun. Like it was just an unbelievable learning experience. Also for me personally, it made me a better person. Like literally just working with unbelievable people makes you a better person. And that like means a lot to me, like holistically.
And that's personal and professional. Like you can work with people and be like, oh, wait, you don't have to sacrifice your morals or your family values or all these things like to be effective. Like when you see well-rounded people where you're like, wow, they are one of the best executives I know, but they're also one of the best mothers, spouses, fathers, brother, sister, kids, aunts, uncles, cousins, like whatever, friends. You're like, oh, it's not mutually exclusive. Like you don't have to sacrifice everything just to succeed financially and vice versa. Some people like are able to do both, like be great people and be great at business.
Yeah, and like company wise, one of the things I'm most proud of is, and I was just a small part of this, but like played a supporting role in to help build a culture that was very team member centric and mission oriented, and built on principles that are unchanging. So that I think Health Catalyst was second to none in setting that up. So it's
it was certainly a unique culture. I remember like very specifically that Health Catalyst, I believe, did not have traditional sales commission. And that was something that always like shocked me back in the day. Because this business has been around for a very long time. That was one of the first companies I had ever heard of that didn't commission their salespeople based on production only. Can you walk people through like what that plan was, why it was built, why it was effective? Because it was super non-traditional.
Yeah, so this is kind of fun. So we had a lot of discussions about this. This is one of those items where ultimately where we got to is there are certain principles that we want like to operate on, like as any business should want to operate on. Like I mentioned before, like ownership as an example is one that's very important on like the sales side. I am helping to drive growth of the business, having a growth mindset, thinking win-win, things like that. But there are tactics that are like instantiations or implementations of those principles that can change over time. So I will say that no sales commissions is one that changed over time. So it is one that had all of the best intentions and the entire company still to when I left, and I assume still today, has the same bonus structure that are based on the same company-wide metrics. So that's a way to drive ownership. And sales team members had the same company-wide bonus structure, just a larger percent of salary. Since a large percent of that was growth. The reason we ended up changing that tactic is it turns out sometimes it's hard as a company to do something different than the rest of the industry.
Correct.
And it made it very tricky for like prospects comparing apples to apples packages with us versus others. So as we needed to scale, it was very successful when we had a relatively small sales team. And then as we needed to scale it, it became harder and harder to scale. But anyway, that's an example of one of those. But what was fun about the company was always trying to think like first principles about how we want to set this up.
You had a ton of success, but what were the biggest challenges you experienced in your time at HC?
Yeah, there were definitely a lot. I mean, I was there for nearly a decade. The one I remember was when COVID started. We were a newly public company. I was CFO, and we served hospitals primarily. They were going through, a few changes during the beginning of COVID. So there was a lot of unpredictability. It's hard to be unpredictable and a public company. So that was certainly a very challenging time. One of the things I feel most proud about it and this came from Dan and others, but in that time we were trying to think about like, okay, how do we work through this? How do we encourage team members to work through this when there's a lot going on in their life? And kind of to the prior conversation, the framework we came up with was that individuals should focus on their personal health first. Because if someone is not physically or mentally healthy, it's hard for them to be a productive team member. So focus on that first, focus on family next, kind of your immediate circle,
Yeah.
and then focus on work.
Uh-huh.
And that sounds like really soft, but it was so fun when, ultimately starting a company and getting advice and hearing a lot of best practices from like some decently like pretty intense people. And a lot of people compared starting a company as an example to you want to set yourself up to be like an Olympian, like in that level of shape, that support physically, mentally. And I think there's something very much to that. It's like a Maslow's hierarchy. So I think that is like an absolute truth. You have to be in a stable position in order to be productive in society. And I think it's important for companies to like recognize that and then like communicate it and like help people understand, even people with strong work ethics, that they need to focus on their personal health first and foremost.
Yeah, like I operate that way. Like if you would have asked me 10 years ago, hey, you're going to accomplish all this, but you're going to have to sacrifice this. Are you willing to do it? In that moment, I'd probably say, no, I'm not going to do those things. But because they were all incremental and it was like, okay, I'm going to like focus on this and get a little bit better. And once it's like part of my routine, then it's part of my routine. And then I work on the next thing and the next thing and the next thing. And it's like, if you would have told me 10 years ago, I'm eating 98% vegan, like plant-based, whole food diet, I'm trying to work out every day. It's been a little more challenging in the last couple of months because now I'm juggling a couple of businesses. But like trying to get in some exercise. I probably drink 3 glasses of wine a month, and I love the taste of, wine and, bourbon and tequila and beer, but like I'm a dad now. I don't have like the luxury of waking up and like feeling a little groggy and like, oh, I didn't get a great night of sleep last night. I worked weekends like in my first handful of years building up this digital health practice before it really existed at my firm. Like all those things, if you'd have told me, oh, you're going to eat completely different, you're going to spend your time differently, you're going to allocate all the time you spent to like socializing and being with friends to like working on your body, working on your mind, reducing stress, like all these things, I'd been like, you're crazy. And no, like, I'm not going to turn over my life, like to do all that, even though what you're telling me I accomplished is pretty damn cool. But, if you do it inch by inch, it makes it a hell of a lot easier.
The other way I think about it is I deeply believe, we talk to our team members all the time, like focus on your personal health, then your immediate circle, your family, and then work. But hard work is also one of our cultural attributes. So it's like, how do you tie those two together? And a lot of it comes down to prioritization. And to be honest, when you're doing a startup, like I focus on those three things, personal health, family, and work, and like not much else. Like it's like those are taking up a lot of
the most successful people have the most boring day-to-day lives. And yeah, they do have like their couple of vacations a year, or they, do a couple of things that's like their splurges. But I would argue 9 out of 10 days for the most successful people are the same repetitive, fairly boring day to the outsider that just, those people love what they do so much they don't get tired of.
Totally. Exactly. And that's finding that intersection is helpful there.
Yeah, absolutely. So walk us through, like you spent over a decade at Health Catalyst, you worked your way up to be president of the company, and then you left a very stable public company in an exec role to start over again and to create a company that's no one has ever heard of, and like you would have to person by person evangelize what the company is, why it's important, why they should, take a bet on you guys. Like walk me through where the idea started and like what gave you the conviction to take so much risk there.
Yeah, for sure. Part of it was I kind of mentioned I've wanted to start a business since a few months into Health Catalyst. So
I'll be the first to admit, once you get an idea, you want to start something, you're screwed. You got to do it. Your brain will never turn off.
Yeah. So I was working towards it for nearly a decade.
Mm-hmm.
I thought about doing it a couple other times, but like the company culture was great, the people were great, and we started to have kids, and kids are kind of expensive, so we needed to save
They
up a
are.
little bit.
Yeah.
So anyway, finally pulled the trigger. Loved loved Health Catalyst, loved the mission, loved the people, but just felt ready. So for me, it was so I had a half a dozen or so ideas when I left, but none of them were great, if we're being honest. For me, the framework I tried to use was could I find a business idea that was a meaningful mission because I cared about improving the health of others.
And if you can't get passionate about something, you're not going to be as effective at
Totally.
it. So you're doing yourself a disservice if you're like, hey, I'm doing this because I think it's what the world needs and I think it's what the highest upside is. But unless you have a personal passion for it, there will be someone that it is their dream to do that, and you're going to get your ass kicked 100 times out of 100 times. If someone else's dream is that, and you're just kind of pretending or like faking it till you make it. So I think it's a really, really important concept to know that, hey, I'm getting up every day excited because like this is what I personally care about. It's not just
Totally.
a grade.
Totally. So a meaningful mission uh, in something that I had a differentiated skill set in, because otherwise, why should I be doing this versus someone else? And it could be a good business. Um, so that's what I was kind of looking for. So I went and spoke to about 100 plus people across the healthcare space. And one of the sets of people or companies I wanted to speak to were advanced primary care companies. By the way, that's what with payers and providers and life science companies, like people all over the space. But advanced primary care companies were one of the groups I wanted to speak to because of the positive data. Both we saw at Health Catalyst, but also that existed in the public domain, specifically on the Medicare kind of ACO front. As background, the government had tried through CMMI, through CMS's innovation program, dozens of different programs to try to maximize the savings through higher experience, higher quality care. And the program that was showing the most promise from a data perspective was giving someone better primary care, paying more for that primary care, but tying the incremental payments to performance. So anyway, so there was all this positive data on these groups. So I wanted to speak to them to see if there's some way I could serve them that could be interesting. They're adding value. It's good tailwind. They're growing fast. Well, it turns out when I spoke to friends who lead and founded a few of these different businesses, they noted that they believe in their solution, like they see it. It is working. In particular, it's been hard for them to sell in to the employer market, to the commercial market, for a few reasons. One, employers have plan members oftentimes in a lot of different geographies.
Yeah.
And these advanced primary care groups are highly localized or fragmented or regionalized. So you have this many-to-many geographic problem. The second reason they noted is because on the Medicare side, you have a third party to adjudicate performance, the value-based payment. But a value-based payment model where you're measuring quality measures, access experience, tying payments to total cost of care savings is pretty complicated for an employer to administer. If an employer has the advanced primary care group administer it, then you have a principal agent problem where the one measuring it, the higher savings they say they drove, the more money they get, which usually is never too sustainable. So they noted if there was a third party to kind of adjudicate performance, that could take that issue out of the system. So
it's like the people who are at the theme parks that it's like, oh, I'll guess your weight. And then they can put their foot on the scale or off the scale. And it's like, oh, yeah, I get it right.
Yeah, exactly. So what the fun part about this is when I was in these conversations, and I deeply appreciate these individuals, we partner with a lot of them now. When I was in these conversations, it all sounded like a pretty good idea because it's a marketplace providing kind of a win-win. But the other thing that related to me personally is when I was CFO at Health Catalyst, our benefits team looked into some of the direct and advanced primary care options. And we ran into these same problems.
Oh, as CFO, you had the oversight because the cost came up to you.
Exactly. I was on the benefits committee. So we would quarterly review these ideas and performance. And we had members all over the country. And we liked paying, our benefits team, who's a great team, they always wanted to try to pay for utilization-based models and performance, have payments tied to performance.
Which I would argue are now table stakes in deals where it wasn't 5 years ago or even 2 years ago.
Totally. So the idea was like, man, if we could create this, there's probably more me's out there that previously were saying no to paying more for better primary care, that we can get to say yes because it now is under a kind of a better financial model and a better geographic coverage. So that was kind of all going on like thinking it was a good business, me having a differentiated skill set. And then on the meaningful mission, I think it was just good timing. I read maybe like a little bit before, but not too much before, the Peter Attia Outlive book, which I love around health span and longevity. And between that and Dr. Brent James, who was Chief Clinical Officer at Intermountain Healthcare, he was an advisor to Health Catalyst. He was pretty influential in a lot of work we did at Health Catalyst. Both of them kind of have key parts of their framework where the vast majority of healthcare outcomes are actually driven not by the care one receives, but it's by behaviors and social determinants of health and, upstream activities. And so like the mission just kind of spoke to me, like serving kind of later in the customer value chain spectrum for a decade. I was like, man, it would be so nice to move upstream. So that really spoke to me. So anyway, that's why we ultimately founded Align.
I love it. Talk to us about from the time you started it to now, just about all the growth, all the success. You've grown at a very, very impressive clip. And I just want to make sure everyone who's watching and listening have context.
Yeah, I appreciate that. I mean, so first of all, so what we are is we're a national marketplace of advanced primary care providers, and we serve self-insured employers and help their plan members, no matter where in the country they are, connect to a great advanced primary care group. And to be fair, look, humility, transparency, they're part of our operating principles. We're still a relatively new business. Like, there's a lot to figure out, but we do feel very fortunate that, to your point, we do seem to have found a real pain point here. So we do feel fortunate that we serve multiple public companies, large national employers, their members all across the country. And I think one of the benefits that we've had is there's kind of been pent up demand for better primary care options out there. Benefits leads wanting to purchase different options, but not having like necessarily an easy way to do that across the country, like so for benefit parity or in a value-based payment model. So I think we're fortunate, and we feel very fortunate to be kind of tapping into, if you will, some of that pent-up demand.
I like that a lot. So you recently closed an additional seed funding of $3 million for that. What advice would you give founders looking to raise right now?
Yeah, it kind of depends on the stage that individual's in. So
let's assume early stage, anywhere from angel through Series A.
Yeah, so starting very early, one of the pieces of advice I got that I loved was some friends that founded businesses actually gave me this idea to give yourself a cannot start until date. So, and the reason is type A individuals oftentimes want to jump on the first startup idea that can work. So I gave myself a cannot start until date, gave myself time to ideate, speak to a bunch of people, and actually tried to kill the idea, spent a couple months trying to kill the idea for Align. Like, wait, this seems like a good idea. Like, why hasn't someone done this before?
You play devil's advocate.
Yeah, totally. Mm-hmm. Because if you're going to be spending a decade, you do kind of want the crux of the idea. It's better for the crux of the idea to be a good idea.
Yeah, you got to be prepared for what will someone counter with, and can you answer those questions well? If not, you're not going to do very well in investor pitches. That's for sure.
Yeah. So if someone's very early, I'd say give yourself time to ideate broadly. Give yourself a cannot start until day. If you're a little farther along, what has helped me a lot is just being kind of a student of business best practices and good business, if you will. Coming from the investing side definitely helped, but there are so many publicly available resources. Y Combinator has unbelievable resources out there, as do others. So then it's like you can kind of check the box on you're thinking, can the business be a good business? Do you have a differentiated skill set? How can you tell that story? What's the insight you have as a founder? Like, how do you view the world differently than the rest of the world views it? Why will that become the norm in the next couple of years? And then the other one, though, that I think people miss sometimes is being honest about the biggest risk of the business. Mm-hmm. So fundraising oftentimes is about de-risking. You're raising enough capital to de-risk one or multiple things from the business, whether that's some product element, go-to-market element. And I think it helps actually when founders are very transparent about what are the biggest risks.
I'd argue with anything. Like, I think if most salespeople try to not talk about, well, what if this goes wrong? Like, what are the downsides? I would argue the greatest salespeople are like, hey, if everything goes horribly, this is as bad as it gets. And let's acknowledge that that isn't that bad of an outcome. But let's talk about if it goes well, like the benefits far outweigh the costs. If you never talk about the costs, then it's all in a vacuum and you don't have any context.
Yeah, exactly. So what are the biggest risks? And then how do you plan to de-risk it? What hires are you going to make? Try to find people that are best in the world at this. And to be fair, there are VCs that kind of promote this. Keith Raboy, as an example, is great at talking about this. But anyway, that's some advice I'd give.
That's great. So you and Aligned recently launched 7-Eleven. If you can you share with us how Aligned Marketplace has been able to help their distributed and very, diverse workforce?
Yeah, of course. One of the reasons that, innovative, great employers like 7-Eleven trust us to help support their members is there is just this, the primary care, unfortunately, that employers are receiving through their health plan has declined over the last decade. A lot of it is not the health plan's fault. It's just there are PCP shortages out there. There's not enough PCPs. A lot of PCPs have been acquired by hospital systems, which don't always have the right financial model to invest in better primary care. A lot of PCPs have been pointed to the Medicare market, which means fewer are pointed to the commercial market. And then a lot of PCPs are just leaving the traditional networks, leaving fee-for-service medicine, and deciding to only get paid under membership or subscription or value-based type payment models. So all of this has led to real access issues. So part of serving an employer like 7-Eleven is us just bringing incremental, highly accessible advanced primary care options to those members. And importantly, because we're a marketplace, we have over 3,000 clinics nationally, in our advanced primary care groups in our marketplace have over 3,000 clinics, 50 state coverage. We obviously don't have any clinics ourselves. We don't directly provide advanced primary care. So we can connect individuals to the best advanced primary care group for that member. And sometimes that's a clinic-based group. Sometimes that's virtual only. Sometimes it's population specific. There's great primary care groups built in the last few years to support great primary care from a woman's health perspective,
Yep.
or from an obesity management perspective, or with pediatric population in mind, or the Hispanic population in mind, or the LGBTQ populations in mind. So it's really like bringing this incremental access to their members. It's not required, but we try to make it as easy as possible for them and meet members where they are. So integration's a key point
Yep.
of large employers like 7-Eleven. We integrate with their navigation and advocacy solution. We integrate with their payer provider directory so that our options can be shown exactly when a member searches the payer provider directory. So it's trying to, meet members where they are and bring them these better, lower cost options.
And I know it was not too long ago that you launched them, so it might be too early to tell, but any results that we can share, in terms of reduced cost or improved, clinical outcomes or reduced wait times, to see a provider, what impact are you having, on the patients and the bottom line?
So there's always some good and some bad. So the good news is measurements like access are measurable right away. That's the good news. So increased access has been clearly delivered by these members easily being able to schedule appointments with providers they didn't have. Bad is metrics like cost and total cost of care.
It's a long
Take a little time,
Yeah.
because you have to have at least a year's worth of performance with claims run out. But one of the fun kind of learnings from them and other early customers is that the industry talks a lot about high risk and high cost members. A small percent of members
Yep.
driving a large percent of the spend.
Yeah, 80-20 rule.
Exactly. And it's even a little worse. It's about 15% in the commercial population, about 15% of members drive about 77% of total. What we like to look at, and this is very much inspired by individuals like Dr. Scott Conard, who's very influential here, probably has as much experience with great primary care in the commercial market. But anyway, what we like to look at is both current cost as well as current risk. So does a member have chronic conditions or care gaps or missed screenings? And where we think our insight, if you will, is that the industry has focused a lot on high risk, high cost members, especially with acute type events.
Yep.
Cardiovascular surgeries, MSK surgeries, cancer treatments, unfortunately. And it's great that the industry is focused on bringing better, higher value solutions there. But what we've seen is that high risk, high cost quadrant of members there's a lot of movement on a year-over-year basis on who's in that quadrant.
Yeah.
And
Who's
that's
low risk today could be high risk in a year,
so
and
what's
vice versa.
underappreciated
It's
is
not always the same group. It's just the same percentage.
in fact, it's been studied. So only about 40% of the high risk, high cost members stay high risk, high cost year over year. And by the way, that's usually from comorbid chronic conditions. Individuals with GI issues, plus cardiovascular, plus diabetes, as an example, where primary care is a great solution. 60% of that bucket moves down on a year-over-year basis from a cost perspective, and they're replaced by high-risk, low-cost members moving up from a cost perspective. And advanced primary care, we think, is the best strategy to prevent those individuals
from getting high cost in the first place.
Exactly. Catching cancer diagnoses early, better managing chronic conditions. And we think about 70% of the movement up is avoidable. So I say all this because over 75% of the members we've engaged have been high risk. So that is a big deal when making a primary care investment because there's better member product market fit there and there's more near-term ROI in engaging.
That's great. Really, really good stuff. Can you walk us through the experience for a member of an employee that has this as a covered benefit?
Yeah, for sure. So from a member perspective, they could either kind of proactively decide to enroll and engage with an advanced primary care group. So that would look like during open enrollment, a member deciding, say, hey, I would love for this to be a primary care group option that I see. Or they can decide throughout the year. We embed our solution in payer provider directories, navigation solution, advocacy solutions, health coaches. So it can be at either point in time. The biggest kind of like one of our viewpoints is payer provider directories from a member experience perspective. There's generally a lot to like in the sense of when you search for a primary care physician, a lot will show up. Mm-hmm. But there's two important shortcomings, which is it doesn't clearly show who has near-term availability. So you have to just start calling those providers. And then ultimately you want to actually like schedule an appointment, and that is very kind of system specific and sometimes manual. So we've tried to close that last mile. So we only show groups on our marketplace that have near-term availability. We have APIs into these groups, so a member can either schedule directly there electronically, or we will schedule the appointment for the member. So that is the biggest deal from a member experience perspective, is really that last mile, taking out all the friction to make it easy for a member to see an advanced primary care group. And then financials, I guess, is the other part from like an incentives perspective, where the groups, employers decide this, but employers have decided to offer these advanced primary care groups to members at no or low cost, which is a big deal because especially with the move to high deductible.
You can waive the copay and take like financial out of the decision. It does boost adherence and participation and utilization drastically.
And with members on a high deductible health plans, they're oftentimes scared to go receive care because they're scared of the bill.
Yeah.
So we can take that out of the equation by letting a member know that they'll never pay more than X.
That was probably the biggest unforeseen challenge with high deductible health plans, was the people who avoid care early in the year because they say, you know what, like that's not what I feel like spending my hard-earned money on today, especially right after Christmas season and, probably spending more than they had all year at the end of the following year and, kind of racking up credit card bills and expenses. January, February, you're like, hey, I kind of rebuild the nest egg. And, sometimes they don't want to do an advanced primary care visit when they're going to have to go 100% out of pocket, or a radiology scan. Whenever you can avoid the patient taking cost into account out of their own out of pocket, you're able to allow people to seek care as soon as they need it.
Agreed.
What is different about the value prop than you initially created, like in the early innings of starting the company? Like what has become more important or more impactful than you even expected?
Yeah, the member choice has been extremely important to drive engagement. So if you're a benefit lead, I think it's just so tough to be a benefits manager or director of benefits and have to decide kind of paternalistically that this one solution is great for all of my members. So the fact that we can enable a benefits lead to push that down to their members and let the member decide. And if that member wants to decide to prioritize in-person versus virtual or weekend access versus early morning or after work access, or do they want to see a clinician that looks like them or has a certain educational background? That's been a pretty important attribute of the model that's been learned, if you will, more over time.
Yeah, some people want like no frills, but it's really convenient and close and low cost. Some
Exactly.
people want the marble, counter in the waiting room. Like everyone prioritizes different things, and everyone would say, "Hey, one person says I'm willing to drive 20 minutes so I can sit in a plush chair." Other people would say, I could care less if it's a park bench, if it's at my employer site and I can save myself an hour of driving. I'll go to the place, right down the hallway.
Totally. Yeah, so that's one. Another has been, so since the beginning, the payments to these advanced primary care groups are utilization based, so per engaged member per month, and advanced primary care groups put fees at risk
Huh?
based on delivering high experience, high quality care to lower total cost. So it's a total cost of care value based payment model, and bringing that to the commercial market for these self-insured employers is pretty fun. What the biggest learning over time is trying to explain that as simply as possible, because tying payments to performance, total cost of care savings, risk adjusting those members can be complicated. So the way we describe it now is these groups are held responsible for bending the cost curve. So for the total medical and pharmacy spend trend, if they can bend the trend for the members that engage versus the members that don't engage, then there's total cost of care savings. So we've like iterating on that and trying to make it as straightforward as possible, like a somewhat complicated topic, as straightforward as possible has been a big learning as well.
Yep. I ask everyone who comes on the podcast, how do you practice what you preach? You have a business in healthcare, but what are you doing personally, like on your own day to day to make sure you're, doing the best you can, to be healthy, be happy, and be a productive, member of society. So I guess my question is, in a very high stress job, venture backed company CEO, how do you reduce stress and, kind of live healthcare as it also is your profession?
Yeah, I'm a big fan of the Upside of Stress book, which is actually, a core tenet there is actually the more stress that someone's under, like it's only better if your worldview on that is positive. Like what it really comes down to is not how much stress, but your perspective on it. That's always resonated with me. In regards to this specific role, what's so mission oriented for me is that if we weren't doing this, no one else would be doing exactly this. And so that's just really inspirational. Try to push an industry forward, do something that hasn't been done before. A little scary sometimes, but that's kind of that framing I think is always really important.
So it's great to, have better perspective on stress, but how do you personally reduce it? Do you do anything from an exercise standpoint to just release it naturally as opposed to just bottling it up?
Yeah, so getting into tactics. So I use like whenever something comes up, I will think about it. Like it will stress me out until I either just start working on it, like do it, or put it on my calendar. So once I put something on my calendar for this time, I'm going to work on this, then it kind of goes away, goes out of like short-term memory.
I operate very similarly.
So that, and then to your point, I was very much inspired by Peter Attia's Outlive, Casey and Callie Means Good Energy. So I try to follow those exercise routines, food routines, between Orange Theory, lifting weights, eating natural foods, high protein. I'm having protein bars pretty often.
Yeah.
I just try to follow kind of those, what are somewhat common sense, just kind of best.
I like that. Really, really good. And any healthy recipes that you and your family have cooked that keep you healthy and might inspire someone else to try something new?
Well, I was just joking around. I think I make the quickest grilled cheese for lunch when I try to have something between meetings. But as far as the family goes, it's just whole food. So my wife being wonderful at supporting us through helping to feed our family, whole foods is generally what we follow there. Because my cooking skills are a little.
From the Nelli family, whole foods, if you eat things that look like they do when they're picked, off a tree or from the ground or whatever, you're probably doing pretty good. If you have to open a bag to eat it, probably not as good. So again, Patrick, thank you so much for joining us on the Digital Health Heavyweights. Really, really happy to see all the amazing success the Align Marketplace has had in a very short period of time. And I'm sure we'll be having you on in the coming years to talk about even more progress coming from Align. So thank you so much. And we'll do nothing but root for you in the coming years until we have you back.
Thank you, Norm.
Thank
Appreciate
you.
it.
Take care. Thank you for joining. Please like, comment, and subscribe below if you enjoyed it.